CDC's decision will have some implications on all parts of our daily lives.
This morning, we're joined by Dr. Wafaa el Sadr, who is a professor of epidemiology and medicine at Columbia Mailman School of Public Health. Good morning, doctor. Thanks for joining us.
Thank you.
All right, first question. Why do you think the CDC is making these changes right now?
I think we are now in a very different place from where we were 2 years ago or even 1 year ago during COVID-19. I think we have now at our fingertips a lot of the tools that we can use to protect ourselves against COVID-19. And I think those are some of the reasons why the CDC has revisited and made some key adjustments in the way we're dealing with COVID-19. I think, for example, being vaccinated and getting boosted as appropriate is very fundamental and important. And we know that a high proportion of people have been vaccinated and have received boosters, as well as also a large number of individuals have been infected already with the SARS-CoV-2 virus. And I think for those reasons, and because we have these tools at our fingertips, we can now say that we can move to a different stage in terms of adjusting and confronting COVID-19.
And doctor, how do you think this will affect Americans and more specifically New Yorkers?
I think it's important. I always say most importantly is obviously is to get vaccinated and to get booster doses and to be always up to date with the booster doses that you are eligible for. I think that's really fundamental. I think number two is that we have to be cognizant that COVID-19 is not over. We're not in a post-COVID era as of yet. So we need to remain vigilant. I think we need to continue to, follow some of the very valuable lessons we've learned from COVID-19. For example, if one is sick, one has to stay at home, not go to work, not go to school, get tested. And again, if need be, go and seek treatment. We have treatments for COVID-19. In addition, if one feels uncomfortable, like, for example, being in a crowded situation indoors, it is the right moment, it's the right setting in which masking is recommended. So I think there are a lot of ways in which these guidance may change what New Yorkers do, but I think on the other hand, I continue to have faith that New Yorkers will continue to be vigilant, will continue to do what makes sense, so we can continue to protect ourselves and our communities.
And kids are going to be heading back to school in just a couple of weeks in our area. So what do these changes mean for them, and what do their parents need to know?
I think importantly, the parents have, and the children themselves and the students have really suffered through the disruption of COVID-19 over the past 2 years in terms of quarantining and so on. So I think the easing of requirements for quarantine when exposed to a case of COVID-19 will make a big difference. And hopefully it will allow for a more conducive, smoother school year and school experience for the students themselves. I, of course, urge parents to seek vaccination for their children. We now are very fortunate to have vaccines that are available and recommended for children. And therefore, getting the child vaccinated is very, very important. At the same time, of course, to be aware that if a child wakes up and they're not feeling well, to keep the child at home and to get the child tested to make sure that they don't have COVID-19 before they go back to school.
Doctor, do you think there's ever a chance we could go back to the restrictions or those lockdowns? Do you see that possibly happening again?
Well, unfortunately, with this virus, we've learned not to be complacent. We've faced different variants over the months and over the years. And I think we're all aware that we don't know what's going to happen in the future. If by chance there's a variant that arises that has characteristics that are alarming. For example, there's a variant that arises somewhere in the world that is able to outsmart our vaccines, that is able to be transmitted more effectively. A variant that where our treatments may not work against that variant. I think those will be the situations where we may need to consider going back to more severe restrictions. So we don't really know what's coming down the line, but I think what we can do now is to minimize transmission of this virus as much as possible, because the less transmission, the less likely that this virus will mutate, will evolve, and create new variants that may be of concern.
Doctor, thank you so much for joining us this morning and shedding some light on what our future might look like. We appreciate it.
Thank you.
And we will continue to follow the CDC's decision to stop social distancing and quarantining all morning long. For the latest on the pandemic, head over to our website, cbsnewyork.com.